السلام عليكم. أعزائي طلاب المرحلة الخامسة كلية طب واسط، معكم الدكتورة اريج صباح رئيس فرع النسائية والتوليد. عنوان محاضرتنا هو Anemia in Pregnancy. Anemia in Pregnancy. Anemia is defined as a hemoglobin HB to a standard deviation below the mean for healthy age-matched population. So the mean value of less than 110 gram per liter in first trimester, and in the second and third trimester, anemia is defined as when the HB level is less than 105 gram per liter. This is due to marked expansion in plasma volume as second and third trimester comparing to the first trimester. While postpartum anemia is defined as hemoglobin less than 100 gram per liter. Iron deficiency anemia. Iron requirement for pregnancy, fetus, and delivery are substantial, with the average woman requiring at least 1,215 milligrams. Iron deficiency anemia affects about 50% of pregnant women and about 56% in developing and 18% in developed countries. نجي على symptoms of iron deficiency anemia. Early stage may be asymptomatic, or there may be fatigue, poor concentration, irritability, tiredness, headache, palpitation, dizziness, and shortness of breath. Signs of iron deficiency anemia: failure of mucous membrane and hyperdynamic circulation. There are specific signs as angular colitis and glossitis, and cholinergia can occur in severe cases. Iron deficiency anemia may affect cellular immunity, rendering women more susceptible to infection. Also, there may be a poor work performance and emotional instability, especially in postpartum period. Diagnosis of iron deficiency anemia. Initially as an iron store are depleted. يعني من البداية أول features of iron deficiency هو depletion in iron store. serum ferritin هو يمثل الأيرون ستار، فserum ferritin level fall. Low serum ferritin is diagnostic of iron deficiency anemia. Transferrin اللي هو iron transporter protein. This iron transporter protein increase as an attempt to deliver more iron to tissue. فالdiagnosis of iron deficiency راح يكون نعتمد على serum ferritin اللي هو iron store، ونعتمد على الايرون transporter protein اللي هو transferrin. MCV is unreliable measurement in pregnancy because why? Due to physiological increase. Serum iron and total iron binding capacity also are harmful as they are affected by factors مثل recent iron ingestion and infection. Complications of iron deficiency anemia. We have fetal and maternal complication. Regarding fetal complication, we have intrauterine growth retardation, preterm birth, infant born to iron deficient woman or mother are more likely to develop iron deficiency in first 3 months of his life. Regarding maternal complication, increased risk of postpartum depression, angina pectoris, or congestive heart failure may develop as a result of marked iron deficiency anemia. Prevention. Regardless of anemia status, daily oral supplementation with their 30 to 60 mg of elemental iron and 400 microgram of folic acid is recommended in pregnancy and puerperia. Treatment of iron deficiency anemia principle is establish cause, correct deficiency, replenish iron. How? Recommended daily iron intake for pregnant women is 30 mg. All women should receive dietary advice on iron-rich food and factors that aid or inhibit. We have factors that increase iron absorption as heme iron, acid as vitamin C, and ferrous form. Factors that reduce iron absorption as tannin in tea and coffee, food rich in calcium and acid. How can we treat iron deficiency anemia? By oral supplementation, intramuscular and intravenous preparation. Regarding oral replacement, for most women, oral replacement is the best option because it's effective, safe, and inexpensive. Recommendation is 100 to 200 mg of elemental iron daily. Then, hemoglobin level checked in 2 weeks. HB or hemoglobin should rise by about 20 gram per liter every 3 to 4 weeks. And then, when the hemoglobin correct, continue for at least 3 months after normalization until at least 6 weeks postpartum. Postpartum women with HB below 100 gram per liter who are hemodynamically stable with minimal symptoms should offer 100 to 200 mg of elemental iron daily for 3 months to replenish iron store. Here we have an elemental iron content in oral iron preparations. Ferrous sulfate preparation, when the tab size is 200 mg, it contains only 65 mg of elemental iron. Ferrous fumarate of 200 mg content of elemental iron is 65 mg. Also, ferrous gluconate of 300 mg tab has a 35 of elemental iron. Regarding intravenous preparation, is reserved for patients who fail to respond to oral iron or who are truly intolerant, such as iron carboxymaltose, which is given as a single dose over 15 minutes, produce a faster response, about 10 gram per liter improvement per week. So, it's particularly beneficial for those women who present late in pregnancy. يعني patient when presented in late pregnancy with iron deficiency anemia, intravenous preparation is better as it has a faster correction ability rather than oral placement. Regarding intramuscular iron replacement, today is rarely used because it's painful and has a variable absorption and can cause permanent skin staining if not given correctly. نشوف السكين staining when intramuscular iron supplement are given. Galloplastic anemia of pregnancy. Macrocytic anemia with low serum level of folate or vitamin B12 in pregnancy is most commonly caused by folic acid deficiency. Vitamin B12 deficiency in pregnancy is extremely rare, as body stores last for several years. Furthermore, B12 deficiency is usually associated with infertility. So the commonest cause for B12 deficiency is pernicious anemia. Symptoms and signs of Galloplastic anemia are non-specific as fluid and anorexia, nausea, vomiting, diarrhea, and depression. Laboratory findings: red cells are macrocytic, MCV usually increase more than 100, serum folate level less than 4 nanograms per mol. Blood film may show hypersegmented neutrophil and over-macrocyte. Gold standard laboratory finding for diagnosis is bone marrow biopsy, would demonstrate megaloblastic erythropoiesis, but a trial of folate supplementation with assessment of hemoglobin response is more practical. يعني احنا بدل ما نسوي bone marrow biopsy نعطيها trial of folate supplementation and then we assess hemoglobin response. With vitamin B12 deficiency the serum level of B12 are seen. لما نيجي نسوي serum B12 راح نشوفه low. احنا نشوف blood film of hypersegmented neutrophil. How can we prevent Galloplastic anemia? Increased risk of patient with increased risk of folate deficiency should take 5 mg of folate daily as a treatment of Galloplastic anemia is 5 mg daily of folic acid 3 times per day, and also should give a diet advice. For women with B12 deficiency, 1000 of microgram of vitamin B12 given intramuscularly or subcutaneously monthly. Folic acid supplementation 400 microgram per day is routinely given in first trimester to prevent neural tube defect for 3 months prior to conception in women who are planning for pregnancy, and a higher dose is given or needed if there is a previous child with a neural tube defect. Also, prophylaxis of anemia in women with potentially dietary deficiency. Folate should be continued throughout pregnancy in women with anti-epileptic drugs. ليش؟ لأنه anti-epileptic drug antagonize folate metabolism. In those women with increased demand as in multiple pregnancy, also folic acid supplementation is given. Sickle cell disease. Sickle cell disease is an autosomal inherited genetic condition where abnormal hemoglobin S contain beta globin chain with an amino acid substitution that results in precipitating when in reduced state. Essential of diagnosis is hemoglobin electrophoresis, which demonstrate the hemoglobin S. Pathogenesis: sickle cell hemoglobin, which is hemoglobin S, result from substitution of valine for glutamic acid when بالbeta globin chain. This will lead to decrease in oxygen tension and lead to hemoglobin S to form insoluble polymers. These polymers deform the normal structure of erythrocyte, and this will lead to cell membrane damage and permanent sickling. البيشنت اللي هو homozygous for hemoglobin S gene have a sickle cell anemia, while patient who is heterozygous has sickle cell trait. زين هسه نجي على risk of sickle cell disease in pregnancy. Sickle cell disease is characterized by chronic hemolytic anemia and intermittent crisis of variable frequency and severity. يعني هاي البيشنت يصير عندها crisis intermittent وطبعا variable from patient to patient in frequency and severity. Also there is a risk of miscarriage in women who are sickle cell disease and fetal growth restriction, premature labor, stillbirth, and increased risk of urinary tract infection, preeclampsia, thromboembolic events including cerebral vein thrombosis and deep venous thrombosis are implicated and lead to maternal death. Symptoms and signs of sickle cell disease. Patient has a chronic anemia due to Y a result from shortened survival time of homozygous S-red RBC due to circulation trauma or intravascular hemolysis. السيكلينج of red cell اللي هو يصير عندها intravascular sickling due to and that lead to vaso-occlusion and then lead to infarction. How? Small blood vessels supply various organs and tissue can be partially or completely blocked by what? By sickled erythrocyte. Lead to ischemia, then pain, necrosis, and then organ damage. Number 3, crisis. Crisis of variable gain frequency and severity occur and usually are precipitated by maybe by dehydration, acidosis, infection. Also, we have other manifestations as increased susceptibility to bacterial infection, as bacterial pneumonia, pulmonary infection, and also urinary tract infection. A patient with sickle cell disease, and she want or planning for a pregnancy should receive a pre-conception counseling. It's important, very important. Now, before pregnancy, the women who have sickle cell disease should get advice as a preconception counseling. شنو هي هاي preconception counseling? It's maternal echocardiogram. Why? To evaluate ejection fraction and look sign of pulmonary hypertension. And number 2, type and screen should also be tested for any sign of alloimmunization. Why? Because many of them or many of those patients have history of multiple blood transfusion, which put them at risk of development of alloantibody that could affect the fetus. Number 3, preconception or prenatal genetic counseling. شوكت if both parents يعني المother and the father احنا عندنا المother هي sickle cell لكن إذا الfather both partner have the gene for S hemoglobin, so their offspring have a 1 in 4 chance of having sickle cell anemia. So the fetus at risk of hemoglobinopathy. So here chorionic villus sample or amniocentesis can diagnose these disorders in the fetus. So pre-implantation genetic diagnosis is used prior to IVF اللي هو in vitro fertilization has allowed for the successful transfer of an affected embryo. يعني بهذول الكيسات إذا both parents carry a gene for sickle cell disease, it is better to offer of a pre-implantation genetic diagnosis to exclude the affected embryo and transfers the unaffected embryo. Prenatal care for sickle cell disease affected women, pregnant women, include prevention or rapid treatment of complications. Pneumococcal vaccine, influenza vaccine should be administered annually لأنه قلنا إحنا دول البيشنت are more susceptible for infection. Folic acid 5 mg per day will prevent megaloblastic anemia, which can result from intense hematopoiesis. Low dose aspirin also given daily to prevent other complications as preeclampsia and intrauterine growth restriction. Number 4. Surveillance for asymptomatic bacteriuria and demonstration of a cure is important to prevent pyelonephritis لأن دول البيشنت are more liable to infection to urinary tract infection. فإذا احنا سوينا لها surveillance for asymptomatic bacteriuria ممكن نقلل ال risk of urinary tract infection and pyelonephritis. Serial ultrasound evaluation is essential. Why? To assess fetal growth لأن دول البيشنت at risk of fetal growth restriction. مثل ما قلنا إنه واحد من الريسك ممكن يصير in sickle cell disease affected pregnant women. Antepartum testing should begin at 32 to 34 weeks gestation. Testing for what? For assessment of fetal well-being. Maintenance of oxygenation, hydration, and antenatal and postnatal thromboprophylaxis. And also regional anesthesia can be safely administered to women or patients with sickle cell disease while they are in labor. Thalassemia. Thalassemia syndromes are the commonest genetic blood disorder. The defect is a reduced production of normal hemoglobin, and the syndromes are divided into alpha and beta types, depending on globin chain is affected. In alpha thalassemia minor, there is deletion of one of the two normal alpha genes required for hemoglobin production. Although the affected individual is chronically anemic, this condition is rarely produce obstetric complication except in cases of severe blood loss. So the beta thalassemia results from defect in normal production of beta chain. Beta thalassemia minor is not a problem antenatally, although women tend to have mildly anemia and low MCV. لكن it is not a problem antenatally. A woman with thalassemia, pregnant woman with thalassemia, managed as follows: check ferritin in early pregnancy, and then give iron supplement only if iron deficient. يعني احنا نقدر نعطيها iron supplement لكن شو كده إذا لقينا عندها iron deficiency. We need also to give her a folic acid about 5 mg per day. يعني البيشنت with thalassemia مو contraindicated نعطيها iron، لا مو contraindicated، لكن إذا كان عندها iron deficiency نعطيها. إذا ما تحتاج، إذا هي ما عندها iron deficiency نعطيها. شلون نعرف هي iron deficiency؟ عن طريق الفيرتين assessment. ونعطيها همين folic acid. زين. البارنتيرال iron نحاول إنه should be avoided. If the woman has thalassemia, the partner need to screen. إذا هو positive, so the couple need counseling on the risk of pregnancy with thalassemia major. So a prenatal diagnosis should be offered for those patients when the partner is affected or carry a trait. لحد هنا انتهت محاضرتنا، وإذا عندكم أي سؤال أي استفسار ممكن تكتبون إياه على الكلاس روم. شكرا جزيلا. أعزائي الطلاب، إلى هنا انتهت محاضرتنا. إذا عندكم أي سؤال أو أي استفسار ممكن تطرحوا علينا بالكلاس روم. وبالإضافة إلى المحاضرة التفاعلية اللي راح تكون على الكلاس ميت، جوجل كلاس ميت، ممكن إنه أنتوا تجمعون أسئلتكم واستفساراتكم ونقدر نسوي عليها ديسكشن. شكرا جزيلا.